We are not stupid. Na sisi sio waoga.
In the morning, you speak like government. In the afternoon, you speak like opposition.
Ladies and gentlemen, welcome back to our YouTube channel. Guys, William Samoei Arap Ruto, the President of the Republic of Kenya, leo ameweza kuaddress nation. Unaona mtazamaji, ameweza kuzungumza. Na kama sijakuwekea video, kama ni mara yako kupata video, hakikisha umesubscribe hapo chini, na kama haujalike, hakikisha umelike, na utakuwa mtu wetu wa maana zaidi. Hebu tazama.
Thank you very much. Your Excellency Governors, distinguished members, and here represented by the CECs, ladies and gentlemen, I am pleased to preside over the official handover of disease surveillance vehicles to each of our 47 county governments. These vehicles not only enhance logistical capacity, but also symbolize the national government's commitment to strengthening public health systems and disease surveillance infrastructure at the grassroots level in line with our bottom-up economic transformation agenda. As part of the lessons learned during the COVID-19 pandemic, Kenya has made remarkable strides in strengthening public health surveillance and emergency response systems through collaborative efforts and strategic investments. Among the key achievements are enhanced preparedness measures, improved traveler screening at points of entry for early detection of health threats and timely activation of rapid response mechanisms. We have also deployed digitized integrated disease surveillance event-based systems in all 47 counties, streamlining processes at both the facility and community levels. Additionally, surveillance officers and frontline responders have been trained and deployed across the country. At the same time, the government has significantly expanded molecular diagnostic capacity and improved reviral systems in our regional laboratories. These efforts have reduced turnaround time for case confirmation during outbreaks and enhanced our ability to respond swiftly to emerging health threats. Ladies and gentlemen, as we continue to confront both ongoing and emerging health challenges, we must remain unwavering in our resolve to protect the health and well-being of everyone within our borders. Counties are the first line of defense in our health emergency preparedness and response efforts. It is through strong collaboration between the two levels of government that we succeed in building a resilient, responsive, and accountable health system, one that not only responds to crises but also is capable of preventing them. The progress we have made in disease surveillance, emergency response, and diagnostic capacity has formed a strong foundation for successful rollout of our Universal Health Coverage Plan and reinforces our commitment to long-term health systems resilience. Since we launched Taifa Care in October 2024, over 22 million Kenyans have enrolled with Social Health Authority with an average of 45,000 new registrations daily, a clear indication that Kenyans are embracing our universal health delivery model. Last evening, Duale, I think 49,000. Yesterday alone, 49,000 Kenyans registered, and about 22,000 actually went the next step to go through a means testing and paid. In fact, I saw the numbers yesterday. 21 million shillings was paid by about 20,000 Kenyans, indicating that Kenyans have begun to understand the value of being in that ecosystem because there are demonstrable witness statements that have confirmed what SHA is doing to our communities across Kenya. We have allocated sufficient resources to fully fund primary health care, ensuring all registered Kenyans can access primary health care services free, fully paid for by SHA. Public health facilities at level 2, 3, and 4, along with SHA-contracted hospitals, should not charge Kenyans as SHA is settling payments promptly. When I say promptly, every 14th of every month, we settle bills for the month, the previous month, every 14th. So next week, we will be settling all the bills for April. We have done so for March. There are only remaining a few cases where there are issues that needs to be sorted out, either between the facility and SHA or between the facility and the hospitals. So we will continue to refine the payment model